Your Skinstructors tip of the week. If you want better results with your rosacea clients, stop trying to do everything in one treatment. I know it's tempting. You want to exfoliate, you want to calm, you want to hydrate, treat vessels, address breakouts all in one session. But rosacea prone skin does not respond well to overload. Instead, I want you to start thinking in phases. What does the skin need right now? Is it inflamed? Is it reactive? Is it stable? When you focus on one primary goal per treatment, whether that's calming inflammation or supporting the barrier, you'll actually get further than just trying to check every box all at once. More isn't always better, more intentional is better.
Welcome back to the Skinstructors. I'm Morgan.
And I'm Jolie, and today we are continuing our Rosacea Awareness Month series. And this episode is a big one because we're talking about advanced treatment strategies and really what actually moves the needle.
Yes, I'm really excited about this episode because understanding the pathology is one thing, but knowing what to do with that information in the treatment room is where everything changes.
Exactly. And before we dive in, we have to shout out one of our listeners, Jazzy J, who left us a review on Apple Podcasts. She said, Morgan and Jolie are passionate about skin, and it shows week after week as they drop gems that are useful as a client and as a provider. They say things in a way for you to understand, even if you're not well versed in all things skin. I love that the episodes are straight to the point. You're in it for a treat if you tune in.
Oh, I
Aw.
love that. That's everything.
Oh, that's so sweet. Thank you so much for that. Those reviews help us more than you guys know, and we read every single one.
Absolutely, we do. All right, so let's get into it. Advanced treatment strategies. I think one of the biggest shifts that we want estheticians to make is moving away from thinking in terms of products or steps and start thinking about outcomes.
Mhm.
What are we actually trying to change in the skin and how do we get there?
Yes, because when you're treating rosacea, you're not just performing a facial, you're influencing inflammation, vascular activity, and barrier function. And if you're not clear on your goal, your treatment ends up being kind of all over the place.
Exactly. So the first thing that really moves the needle is treatment focus.
Mhm.
If your client comes in flushed, hot, reactive, your job is not to sneak in exfoliation because you feel like you should. Your job is to calm that skin down.
And that might mean simplifying your treatment more than what you're used to. Fewer steps, less stimulation, and more intentional product selection, because that's what the skin needs in that moment.
All right, another big one to understand is timing.
Mhm.
So, rosacea is not something you aggressively treat every single time you see it. There are phases where the skin is more stable and also where there's phases where it's more reactive, and your treatments should reflect that.
Yeah, and there are times where you can introduce mild exfoliation, gentle actives, or more corrective work, but that should be when the skin is calm and supported, not when they're already inflamed.
Yeah, because this is where a lot of treatments go wrong. We treat based on what we want to do
Yeah.
instead of what the skin is ready for.
Yeah. So let's talk about exfoliation for a second because this is a big one. Exfoliation isn't off the table for rosacea, but it has to be done with intention. And I think there's this like fear around it where people either completely avoid it
Mhm.
or they go in too aggressively. And we want to find that middle ground where you're making decisions based on the skin, based on what the skin is actually showing.
Right. Yeah. The goal isn't to aggressively resurface the skin, it's to gently support that cell turnover without triggering inflammation. And you guys know me, I love to exfoliate. You know, I want to
Mhm.
just burn all my skin off. I will absolutely push the skin to get results. But the difference is you have to know what that limit is. You have to understand when the skin can handle that push and when it's going to push back. So we're thinking lower strengths, appropriate formulations, and really paying attention to how the skin responds. But before you can even choose an exfoliant, you have to ask, is this skin ready for my choice? Because readiness really is everything.
Yeah. So, what does that actually look like? If your client's skin is coming in flush, hot to the touch, stinging, or just generally reactive, that's not the time to exfoliate. That skin is already in an inflammatory state, and exfoliation is just going to push it further.
Yeah, for sure. And if that skin looks more stable, you're
Mhm.
noticing less redness, more even tone, no active irritation, and your client isn't reporting any burning or sensitivity, then you can start to consider introducing appropriate exfoliation in a very controlled way.
And another thing is to look for texture. If you're seeing buildup, roughness, or that kind of dull, congested look, those are signs that gentle exfoliation could actually help improve the overall function of the skin.
Yeah, because if it's done correctly, exfoliation can enhance your product penetration, improve hydration, and support that overall skin renewal process. But it's always about the dose and the frequency. So you don't need to do a full exfoliating treatment every time. Sometimes it's just a small controlled step within a larger calming focus treatment.
And I want you to also think about history.
Hmm.
Has the client tolerated exfoliation before? How did their skin respond last time? Did they flare or did they handle it well? Because that information is gold when you're deciding how to move forward.
Hmm. Yeah, you're not guessing, you're building on what you already know about their skin. And if you're ever unsure, you can always scale back. Don't
Hmm.
be afraid to take a step back, shorter contact time, lower strength, fewer layers of the peel or whatever you're applying. You don't have to go all in to get the benefit.
Right.
I think a lot of clients feel like, oh, I have to completely peel my face off to see a
Right.
change. And, you know, these products are formulated in a way that you're going to get cellular renewal and changes without the irritation and downtime.
Totally. And also understanding that not every rosacea client needs exfoliation right away. Sometimes the best thing that you can do is build that skin up first, build that barrier up, support it, calm the inflammation, and create stability. And then you can start layering in exfoliation when the barrier is ready for it.
Yeah, this is kind of like what we did with your skin, Julie, when we did
Hmm.
we jumped you into like doing an aggressive retinol. Like Julie did, was it 4 weeks or 6 weeks? I think we did 6 full weeks
I
of
think you're right.
like a sensitized protocol, and we really helped to strengthen the skin so that she could handle a
Mhm.
really aggressive retinol,
Yeah,
and it really
absolutely.
helped.
It did. I had used this retinol in the past without the prep and, would get your normal reactions from it, anticipated reactions from it. And then I took a little break from it and we did this calming protocol first, build up my barrier, and those reactions were not nearly as bad as my first time
Yeah.
around.
Yeah, don't be afraid. I mean, I know we're talking acne right now,
Right.
but, I like to treat rosacea and acne very similarly, so don't be
Mhm.
afraid just to smother your client's skin in the most nourishing ingredients possible for a full skin cycle, and then you can then you know it's gonna be able to handle the more aggressive treatments.
Yeah.
Another strategy that actually moves the needle is consistency over intensity. So, what I want you guys to really hear is progressive versus aggressive, because one aggressive treatment is not going to fix rosacea.
Mm-mm.
In fact, a lot of times it can set you back. The skin can flare, it can become more reactive, and now you're spending the next few appointments trying to calm everything down again.
Yeah.
So, consistent progressive treatments over time, that's where you see real change. You're building tolerance in the skin, you're supporting the function, and you're slowly guiding the skin instead of forcing it. And I'll give you a real life example here. My sister the last few weeks has been coming in. She has rosacea. She's to the point where she's so frustrated with her skin, and no matter how many times I say, like, I can help, she finally listened. And
Mhm.
she came in. I have her coming in weekly, and we've been doing a zeostimulator peel on her
Mhm.
consistently. It's nothing crazy. It's no downtime, lunchtime red carpet peel. Nothing over the top. It's just progressive, controlled exfoliation.
Yeah.
And the improvement in her skin is crazy.
Mhm.
Like, one peel and I was like, "Wow, like, I don't actually need you to come in every single week." But
Right.
I'm still doing this little test on her, and I'm excited to see what happens over the next few weeks. Not because we went in aggressively, but because we stayed consistent, we respected her skin, and we built on it week after week.
Yeah, her results have been crazy.
Mhm.
I hope you post those.
Oh, for sure.
Okay, good.
Yeah.
And that's such a good example too, because I think a lot of clients and honestly maybe providers too are looking for that one treatment that's going to help change everything.
Yeah, they are. It's where's the magic fix?
Right. And that's just not how rosacea works. And this is where client education becomes so important because if your client expects one appointment to fix everything, they're going to be disappointed and they're going to think nothing is working. But when you explain that this is a progressive process, that we're building their skin up over time, they start to understand that value of consistency.
What you said is exactly key here. So, explaining the process, like, we have to educate. Otherwise, your person who's coming in for the quick fix, they're not going to get it. You didn't
Mhm.
explain it. They're not going to be happy. They're going to write a Google review. They're going to tell their best friend, their neighbor, and their mom not to ever
Right.
come see you. But if you took the time to say, this is a progressive approach, it's best to do this in steps, not to destroy your skin, they're going to respect you and they're going to trust the process so much more.
Exactly, and that's when you start to get better compliance, better home care, and ultimately better results. Because rosacea isn't just something you attack, it's something that you're gonna manage, support, and improve over time with a really intentional, consistent approach.
I love that you said attack. I do want to attack it.
Right.
I'm just All right, so we can't talk about treatment strategies without talking about home care. Because honestly, what your client is doing every single day matters so much more than what you're going to do once a month. If they're using harsh cleansers or layering on all the actives
Yeah.
or constantly switching out products, you're never going to get ahead of their rosacea. They're
Mm-mm.
not going to see changes. So your job is to simplify, you're going to guide them and actually make their routine something that they want to use and that supports what you're trying to accomplish
Mhm.
professionally. For my sister, she had a pretty simple routine, but I swapped a couple things out
Mhm.
and she uses, a cleanser. She uses, Maestro, Treolux, and SPF, and, like, we're golden.
Yeah.
It's amazing. For rosacea, you really do want that very solid foundation. It doesn't have to be a ton of stuff, just a gentle cleanser, a barrier supporting moisturizer, and daily SPF. And of course, I love to add in a redness product there. But those three, the cleanser, the moisturizer, and the SPF, those are your non-negotiables.
Mhm.
Then we start adding in those calming products. So we've got your ingredients like niacinamide, ectoin, green tea, azelaic acid. We love those ingredients because they help to regulate inflammation and support the skin without overstimulating it.
100%. If their home care is too aggressive, too inconsistent, or full of triggers, it's going to undo everything that you're trying to do
Mhm.
in the treatment room. And this is also where we can start to be strategic. Because rosacea is a sebum based skin condition, we do want to think about oil regulation,
Mhm.
but in a way that doesn't start stripping or irritating the skin. So, lightweight moisturizers, balancing serums, and ingredients that help minimize sebum production without being too harsh are going to be key here.
Yeah, exactly. You don't wanna dry the skin out controlling that oil. That's just going to create more reactivity.
Hmm.
And then once the skin is stable, this is where you can thoughtfully introduce exfoliation at home. That might look like a very gentle alpha hydroxy acid, a mandelic based product, or even a low strength lactic acid used once or twice a week. That's going to be something that supports that cell turnover without pushing the skin into inflammation. Or even enzyme based exfoliants. We love those for our rosacea
Ew.
clients who are more sensitive.
And again, this goes back to readiness.
Yeah.
If their skin is flaring, reactive, or compromised, this is just not the time to send them home with exfoliating products. But if their skin is calm, stable, and tolerating their routine well, adding in that gentle exfoliation can really help with texture and product penetration and overall skin function.
And the biggest thing here is consistency. Not that they're on a 10-step routine, not constantly switching products, just a very simple, supportive routine
Hmm.
that they actually stick to. Because when their home care aligns with what you're doing in the treatment room, that's when you start to see results.
Yeah. And something else that really moves the needle is paying attention to triggers.
Mhm.
Because if your client's getting a consistent flare up and we're not addressing why, we're always going to be trying to play catch up here. And this is where I think a lot of people skip a step. They focus on treatments and products, but they're not always looking at the patterns behind those flare ups.
Yeah, so things like heat exposure, diet, stress, overuse of actives, those all matter.
Hmm.
The tricky part is that triggers are different for everyone. You can't just assume that one client has the same trigger as another.
Hmm.
Um, so instead of guessing, it's always best that they just start tracking.
Yeah, and this is something you can actually have your clients do at home. So just create a simple log. Nothing complicated, just noting when they're having a flare up, what they ate that day, if they were in heat, if they exercised, or if they were stressed, if they tried a new product.
Yeah, and then over time, those patterns are going to start to show up. Maybe every time they drink red wine, they flush, or maybe it's hot showers. It could be that exfoliating serum that they're using 3 nights in a row. That information is so valuable because now you're not just reacting, you're preventing.
Exactly. And when you walk through that with your client, they start to feel more in control of their skin. It's not random anymore, it's not unpredictable. There's a reason behind what's happening.
And that's huge for compliance too. Because when they see the connection right in front of them, they're able to connect their habits in their skin. They're way more likely to make those changes.
Yeah, so don't skip this step. Encourage your clients to track, review it with them, and use that information to guide your plan, your treatment plan, because that's how you stop chasing flare ups and start getting ahead of them.
Absolutely. Before we get into homework, we do have to talk about one more treatment that truly moves the needle for rosacea, and that's BBL.
Yes, broadband light is incredible for rosacea, especially when you're dealing with the vascular component, persistent redness, flushing, and the visible vessels.
Yeah, with broadband light, BBL, or even IPL, intense pulse light, either one, it's not managing this just the symptoms. We're targeting the vessels themselves.
Mhm.
It works by delivering light energy that's absorbed by the hemoglobin in the blood vessel. So So that helps to reduce redness over time. And when it's done consistently, the results can be really, really impressive.
Yeah. And this is something we see all the time at
Hmm.
Boscal. Our medical providers perform BBL treatments, and the improvement in our rosacea clients is honestly amazing.
Yeah, so clients come in once a week for a series of 4, and it's amazing. Now, depending on where you live, what state you live in, you definitely have to understand your role as an esthetician. So in Ohio, estheticians cannot do laser treatments, but there are other states where you can take additional courses and do that. That's why we have medical providers who are performing those services. So you might not be able to perform that BBL yourself, but if you can't, you should still be able to recognize when a client is a good candidate for that service and then
Mhm.
refer out.
Totally. This is about collaborative care. So you're supporting the skin topically and through your treatments, and then pairing that with something like BBL to address the vascular side more directly.
Absolutely. If you offer hydrofacials too, and if you combine, like create a treatment plan that involves a hydrofacial with BBL, it increases the results by, I want to
30
say like
to
30%.
yeah.
Yeah, it's crazy. So if you have a hydrofacial machine and you have a medical provider who does BBL, like partner and create a package, that's a really great treatment for somebody with rosacea.
So don't be afraid of it. Don't overlook it and definitely don't hesitate to have that conversation with your client when it's appropriate. All right, let's talk homework. This week, we're going to challenge you a little bit. If you're someone who tends to play it too safe with your rosacea clients, I want you to take it a step forward.
Yeah. So because the bigger issue we see a lot of the time isn't over treating it, it's under treating.
Definitely. So this week, I want you to identify one client whose skin is stable, not flaring, not reactive, but in a good place. And I want you to thoughtfully level up their treatment just a little bit.
So that might mean introducing a very gentle exfoliation when you normally wouldn't, or slightly increasing the intensity in a controlled way, or even progressing their treatment plan instead of repeating the same thing over and over.
Yes, the key word here is intentional. We're not being aggressive, we're just being progressive. But I want you to get comfortable recognizing when the skin is ready for more and actually acting on it.
Yeah, because confidence comes from experience. And you're not going to build that if you just stay in the safe zone forever and ever.
Yeah. So this week, trust your knowledge, read the skin, and take that next step.
And if you want to go even deeper into this, we're getting ready to launch something we're really excited about at the end
Yeah.
of April on our website. Our website is www.estittraining.com.
We're going to be diving into advanced protocols, treatment planning, ingredient strategies, all the things that help you feel more confident and more intentional in the treatment room.
We can't wait to share this with all of you just a few more weeks. Thank you so much for being here with us today.
We appreciate you guys so much. And don't forget to rate, review, and subscribe and follow us on our Instagram at ST Training.
And as always, don't hesitate to educate.